we will start with this clinical diagnosis chapter. This will be the first chapter when you enter in your final year. And this chapter is also important from your case history point of view. Okay, so case history, when you people record this, most of the part from clinical diagnosis, you have to apply. Okay. So introduction for this topic is means proper diagnosis is essential for proper treatment. So periodontal diagnosis should first determine whether the disease is present. It should be identify the disease and its severity and extent. So diagnosis must be therefore evaluation, general evaluation and consideration of oral cavity or periodontal findings. Okay, so and you should able to know the underlying pathologic processes. Okay, so periodontal diagnosis is determined after careful analysis of case history. Means when you people are recording case history in your OPDs, that time also this part is important, clinical diagnosis part, and the case history part is important for diagnosis, because in case history you evaluate clinical signs of that disease, symptoms of that disease, and other diagnostic procedures like blood investigations or other clinical findings. So all findings you record, and all clinical findings will give you a reach to a particular diagnosis of the disease. Okay, so to know what to diagnose means you people record case history and all everything, but you have to write some diagnosis. When you write case history, in your case history, to write your diagnosis you should know the name of that disease or clinical findings. Group of clinical findings will give you to or reach to a particular diagnosis. So before that you should know all the disease, name of diseases. So for that purpose you should know the classification of disease. Okay, so classification of disease is very important. We categorize the clinical signs and symptoms collectively, means similar type of finding we categorize, and we give some terminology to that particular group of findings. So based on that finding, we write our diagnosis, particularly for that case. You evaluate the clinical findings in that case and you write a particular diagnosis. So which part is important for writing your diagnosis is classification of periodontal disease. So classification of periodontal disease is a chapter separately which was taught in your third year. But you people have entered in the final year and everything is washed. Okay, so you have to read again your classification of periodontal disease, which is the first chapter. Okay, third chapter. So you read or you try to find out from your notebook or the previous or if you get something online books, that time also you can find it out. Okay, so you try to find out classification of periodontal diseases, which was actually taught to you earlier, but you people are at your own places or native places, and you people might not be having books for this final year subjects. But for final year you will get most of the important knowledge from net also, but try to search for any online book related with perio. Okay, so first you read classification of periodontal diseases, then only you can analyze the case history properly or clinical signs and symptoms, and you can reach to a particular diagnosis. So it should be properly organized, specific process. Case history recording is a specific process. So case history, your case history is categorized into a few parts. Like first will be your introductory part or general information about your patient. So for clinical diagnosis also you should know general information of patient. In general information there will be name, age, sex, and chief complaint of patient will be there. Other than that, history of present illness is there. So you should know all these things. So you should know first general information of your patient, name, age, sex, name. You should identify your patient properly. For that purpose, name is important. age, few few of the cases. Hello, Rohini, Rohini Magar. हाँ, record करायची का? हे तर
नऊ पाठवले. बेचाळीस पार्टिसिपंट्स आहेत, 9 जणांनी 10 पाठवत आहेत.
काय पाठवतोय?
मॅम लास्टला काय मी नाही येते डिपार्टमेंटला जात आहे. चॅट वर जाते.
ओके. तुम्ही अटेंडन्स पाठवतो का?
हा पाठवत आहे. चॅट वर जायचं आणि सेव्ह चॅट वर येतं.
ओके.
लास्ट पाठवत आहे.
अजून पूर्ण पाठवतो. All of you register your name in chat box so that your attendance will be recorded. Okay, so your case history or clinical diagnosis is divided into few parts. First part is general information of your patient. In general information, you people will be knowing about patient age, sex, few diseases are age-related diseases are there. Then few diseases may be commonly seen in female or commonly seen in male. So depending on that, you should know age and sex of your patient. Other than that, chief complaint should be recorded in patient's own word. So I'm telling about general few part. So chief complaint should be recorded in patient's own word, and then you have to write history of the present illness. Okay, so that will be your general information part. Diagnosis is mainly dia means it is a Greek word. Dia means through, and gnosis is knowledge. Okay. So, in making periodontal diagnosis, clinician must answer three simple questions: what disease is present, means which kind of disease is present, where is the disease, whether it is localized, generalized, or extent of disease will be answered by this question, and how severe is disease, means it is slight, moderate, or severe. Depending, so you should, while writing a diagnosis, you should ask question to, so that you can answer and you will get the diagnosis also. So general information, in that general information you will write about all these things. Just now I have told you, that is patient name, age, sex, address, then patient chief complaint and history of present illness. After that, you have to record patient's medical history, patient's dental history, family history, and baseline vital signs. So, when you are recording patient's medical history, you have to ask about any pre-existing systemic disease, or sometimes patient might not be knowing about his disease, and you are suspecting some diseases like diabetes mellitus, you people are suspecting, so you have to ask the patient some related signs like prolonged wound healing is there, or patient is having suffering from some proper, most of the times commonly infections can be seen in diabetic patient, and patient is not able to cope up, or wound healing is not proper. It can happen in uncontrolled diabetes mellitus patient. Other than that, some signs are also there in uncontrolled diabetes mellitus like polyuria, polyphagia, polydipsia. So you have to ask the patient sometimes if you are suspecting, and then you have to send for particular diagnostic test for that particular disease. If you are suspecting patient is having hypertension, you have to record blood pressure of that patient. So pre-existing systemic diseases, you have to ask to your patient previous histories of hospitalization, any surgeries or medications, if any allergy patient is having, all these is recorded. And this history is going to help you when you are writing your diagnosis, because hypertensive patient, see, uncontrolled diabetes mellitus, it is directly related with periodontitis. So periodontal complications or inflammation will be more in uncontrolled diabetes patient. Then if patient is taking antihypertensives in a hypertensive patient, these drugs can induce gingival enlargement. So gingival enlargement is common disadvantage or common consequences after taking these drugs. Any surgeries, medications. So you have to ask all detailed histories about his health or medical history. Then family history, you have to ask family history also, because some diseases are vertically transmitted from parent to child or parent to next generation. So some cardiovascular diseases are there, type 2 diabetes mellitus is there, some bleeding disorders are there, periodontal diseases are also there. You have to ask to siblings also. Family history in that aggressive periodontitis is genetically transmitted disease. So you have to ask about patient's siblings, like whether patient sibling is having also similar kind of clinical features or clinical disease. So you have to ask family history also, because some diseases are run in a family. And then baseline vital signs you have to check. So laboratory diagnostic test for diabetes mellitus, if you are suspecting, then fasting blood glucose level you have to ask to go for, or fasting, then postprandial or random. It should be lesser than 126 GDL. So you have to ask the patient for this diagnostic test. Other than that, if patient is having already diabetes mellitus, then your test will get changed. You no need to go for diagnostic test, but you have to go for monitoring type of test, monitoring the blood glucose level. So for monitoring test, there are glycosylated hemoglobin assays there. So this assay has some findings, like normal range is given, that should be 4% to 6%. Good diabetes control or glycemic control should be lesser than 7%, moderate 7 to 8%, and action suggested to improve diabetes control more than 8%. Any problem? Who is there? If you have any question, you can ask. Otherwise, mute your phone. Okay. So, monitoring type of test is glycosylated hemoglobin assay, which gives you the blood glucose level for 3 months, last 3 months. So, because of that, we call it as a monitoring test. Diagnostic test is fasting blood glucose level or random blood glucose level, postprandial blood glucose level, that are of diagnostic type of test. So these are the for diabetes mellitus. These are few tests. Just I am telling you that you have to ask your patient, if you are suspecting. You have to ask your patient to go and check for these kind of tests. So, what is significance of this all medical history? That is possible impact of systemic diseases on periodontal disease. You will know. Then special precaution you have to take if the patient is having systemic disease, like patient is having bleeding disorder, you have to take some precautions, or any infectious disease patient is having, then you have to take some more PPE kit and all precautionary type of measures. Influence of oral infection on systemic condition. Sometimes oral infection can also affect on progression of systemic disease, and vice versa. Means systemic disease can also impact on progression of periodontal disease. In the similar manner, periodontal disease can impact on progression of systemic disease. Okay, so you should know the history, health history properly. So this is a flow chart which tell you about this kind of. Now we'll move faster, because a dental history. To know dental history, you have to ask any previous dental problems to your patient, oral hygiene regime, type and nature of current problems, its onset and progress, and parafunctional habits. All these things will give you patient's attitude towards dental treatment. Means whether patient is aware towards his oral hygiene, it will give you idea about patient's attitude towards oral hygiene. So because of that, dental history is also equally important. You have to ask your patient regarding his oral hygiene, any previous scaling history or oral hygiene maintenance, how he brushes, which kind of brush he uses, how frequently patient changes his brush. Along with that, any previous history of dental treatment, during that if any untoward event is happening like syncope and all. So because of that, patient attitude may get changes. Patient will be feel more anxiety regarding dental treatment. So for that purpose, you should know all details about patient's dental history also. Okay. It will give you some ideas. This is also a related, a similar flow chart which shows. Then move towards extraoral examination. Okay, so facial structures abnormalities you have to evaluate properly. Temporomandibular joint (TMJ) you have to evaluate. Few methods are there: standing behind the patient and ask the patient to open mouth, or some you have to in the next another type of method you can stand in front of your patient and you can evaluate. So temporomandibular joint, deviation of joint or clicking sound if patient is having, or any pain related with this joint closure. So you have to evaluate all these things. Then muscles of mastication, then lymph node palpation. Lymph node also, again you have to palpate submandibular lymph node. Um, Submandibular lymph node you have to evaluate. One second, I'll just record your attendance. Okay, so after extraoral examination, you have to go for intraoral examination. Intraoral examination, in that you have to check number of teeth present or absent. If absent teeth are there, then you have to ask the history of tooth loss. Means what is the reason behind that, whether caries or mobility. If mobility is there, then you can ask the patient, or you can suspect the patient's attitude also. Because in periodontal disease, very commonly people can see mobility of teeth. So, other than that trauma, history of trauma and all, you will come to know whether if history of tooth loss, you have to ask. Then oral hygiene and presence of local deposit. Local deposit in that presence of plaque and calculus, you have to ask about that. Then dorsum of tongue, oral malodor, abnormalities of associated structure, then vestibular floor of mouth, everything you have to evaluate properly. Cheek mucosa, lining mucosa, any ulceration is there. On dorsum of tongue, any tongue related clinical features or tongue related clinical diseases or clinical conditions. Rightly we can call it as a condition, geographic tongue or ulceration on the tongue or lateral border. So you have to evaluate all these things in intraoral examination, and any abnormalities if they are there, you have to notice that abnormalities and you have to write about abnormalities. Then a number of teeth present, impacted teeth or extracted teeth, history of extraction, cause of that extraction. Then vasting diseases of teeth. In that mainly there are four type of diseases based on physical causes. These are the three different types: attrition, abrasion, abfraction, and chemical causes are erosion. So physical causes in that various physical causes like faulty brushing technique is there. Then history of parafunctional habits like grinding of teeth, gnashing of enamel rods occurs, and it gives you the appearance of facet on occlusal surfaces of molars. So attrition, various I think images are also there. I'll show you images. Now see here, attrition, that is because of constant biting or gnashing of enamel rods, you people can see this fine shiny surface on the occlusal or incisal edges. And there are facet formation. Facet means deepening. Type deepening is there. There are two different types of facets are also there: vertical and horizontal facets. So attrition, you people should know what exactly attrition. That may be because of parafunctional habit like night biting habit or grinding habit. So this will lead to attrition of teeth. Active gnashing of enamel rods takes place here. Abrasion, it is because of faulty brushing technique or sometimes bobble pin holding. So usually it is seen in corner teeth. Who is ready? Write your name instead of your phone. Okay, then only we will be able to know your attendance. Write your name. So abrasion, you faulty brushing technique like this chapter will be taught in two parts. Okay, so today we will. Hello, am I audible? Hello.
Yes, ma'am.
Okay, we will continue for another 10 minutes, and next part I will teach you in next classes. Okay. So abrasion is because of faulty brushing technique. You people might be knowing these attrition, abrasion, clinical conditions of erosion is a basic cause is chemical. Chemical because GERD, that is gastroesophageal reflex. When patient is having regurgitation, acidic, or patient is having food habits, acidic beverages and all, and regurgitation will lead to dissolve this whatever inorganic component of the tooth get dissolved, and it will lead to a shiny surfaces usually seen on the palatal surfaces of the incisors upper anteriors because of GERD reflex. Patient that whatever acidic part is there or component of your vomit will come in the oral cavity, and because of that it will lead to erosion or eroded surfaces of maxillary and palatal surfaces. And attraction is because of the flexure of that cervical area because of biting forces. The cervical rods, enamel rods get flexed, and that because of flexure, it will lead to this clinical feature like this. So active, whatever loss of tooth surface in the cervical area will lead to abstraction of that area. So these are the wasting diseases of the tooth. So you have to record that. Other than that, trauma from occlusion, you have to find. You have to check for trauma from occlusion. You have to check for Fremitus test. We will see that part in your next few classes. Okay. So next part, up to this, it was categorized into general information, then your extraoral features or extraoral signs, then extraoral examination, then intraoral examination, and you have to ask about the history of habits. Habit of brushing technique, habits of all. Your case history will include this part also, habits. Related with habits, brushing technique, frequency of brushing, patient is having any smoking or smokeless tobacco eating habit. So all these things you have to record under that part of your case history. Okay, so case history, you have your journal. You people have written two types of journal in your third year. First is you have written your instrument journal, and second type of journal which is there, which you have got from your store. In that journal, you have to write your case histories, and in that you people have printed pro forma also there with you. So you people can go through that pro forma. There are different parts or different components of your case history. So in clinical diagnosis, we have recorded, we should record general information followed by habits of patient or related brushing, oral hygiene habits of your patient, then extraoral signs or extraoral examination, then intraoral examination. So we'll start intraoral examination. In intraoral examination, teeth, in that number of teeth present, then your part like wasting diseases, trauma from occlusion, Fremitus test, then other related caries and all carious teeth identification. All these part will be your related with your teeth related part. Then you have to write about gingival status, then periodontal status, mucogingival status, then your provisional diagnosis, your diagnostic procedures like IOPAs, OPGs and all, and then you will write about your final diagnosis or concluding diagnosis. After your final diagnosis, part of case history will be your treatment. Okay, so this will be overall clinical diagnosis part. So in the next classes, we'll see about gingival features, periodontal features, and your mucogingival status. Okay. Today we'll start with gingival status. So gingival examination mainly it is related with color, contour, consistency. These 3 C's are there in your gingival examination. Then 2S are there, that is surface texture, then shape of gingiva, size of gingiva, and then these 3S, 3Cs, and lastly position of gingiva. See here exudate and gingival exudate is different part. I'm telling from your case history pro forma. In your case history pro forma, 3 C's are there, 3S are there, one position of gingiva is there. That is come in a square box or one box is there in which you have to record your case history. So color is decided by mainly by gingival keratinization, then gingival vascularity, and then gingival thickness. So all these factors, melanin pigmentation, all these factors will decide color of gingiva. So any color change in that is in chronic inflammation, you people can see bluish type tinge because of vascular engorgement and vessel extravasation of fluid and vascular engorgement will lead to color change in gingiva, that is bluish tinge is there. Then other than that, after color, this is for chronic cases or chronic inflammation. In acute inflammation, you will find bright red color. So bright red color is very commonly seen with acute abscesses. So that is mainly color change which occurs in the gingival cases or gingival diseases. Then edema or swelling, contour, gingival contour changes is there. So gingival contour, in that usually contour is knife-edged. See here, this coral pink color of gingiva here, color consistency is firm and tight and resilient. This is normal consistency of gingiva, but in inflamed consistency becomes soft and edematous because when inflammation is there, the fluid from vessel or gingival connective tissue vessels or vasculature comes out from the vessel wall and it accumulates in the extracellular and intracellular areas in the connective tissue, and because of that consistency becomes soft and edematous. Sometimes consistency will be fibrotic. Because of fibrotic component is more, then consistency becomes leathery type of consistency. Okay, so this part of gingiva, till this part we will complete gingival part partially. In the next